So good afternoon, everyone. This is Audrey Russo, and I have different lighting today, and there will be no dogs in the background. So if I look a little spooky, I'm sorry, I don't mean to scare you, but I am very, very thrilled with today's guest, a dear friend and colleague and leader in our community that I will more formally introduce in one moment. Always want to give a shout out to Huntington Bank and the work that they do in partnering with us. Deeply appreciate them and the work they've done over the last 13 months and plus over the last many years in terms of their civic engagement. Also 40 by 80, that's the organization that's wholly owned by the Tech Council, and that is our 501c3 charitable arm, and we focus on all things that are related to building tomorrow. So building tomorrow is entrepreneurship, as well as K through 12 engagement. And soon you're going to hear more about our apprenticeship program. So we have muted your microphones. And for me, I can tell you, if we have noise, it will not be dogs. It might be something else, but it's not dogs. And we have an opportunity to chat. And the chat is only directed at our guest, the esteemed Dr. I'm going to call you Dr. Karen Feinstein, because I think you deserve that, and people need to recognize the kind of legend and the work that you've done for our region. And I am very thrilled to introduce Dr. Karen Feinstein, who has become a good friend of the tech community, but has always been an innovator, has always been outspoken, and has always been passionate about seeking greatness, and greatness as it's tied to the work that she does at the Jewish Healthcare Foundation. So, hi Karen, how are you? Thank you so much for joining us today. I can't thank you enough, and I have so many nice things to say about you, but I will save that as we get into the conversation, because you have been a leader in driving change and in addressing issues around safety and patient care and innovation. And there's not anything in the space of healthcare that you haven't touched during the work that you've done over the course of, I don't know how many years, but I want to jump in and say, first of all, how are you? How are you holding up through all that's been going on? Because I feel like you've been extraordinarily busy in your work. And then second, just set the table and tell people about sort of the creation of the foundation.
Well, I'm doing very well, I guess. Thank you. I expected this rush of ecstasy when I got vaccinated and started connecting with people again. And I'm waiting for the rush of ecstasy. Right now, I can't tell whether we've really gone through the pandemic, we're ready for a new surge or whatever. I'm very lucky. The foundation's been very busy. And, you know, when you're a health foundation during a pandemic, there's not a lot of time to sit around and reflect and feel sorry for yourself. I also have one big advantage. I have 15 immediate family members in walking distance. That's my kids and their kids and my sister. So I'm not lonely. The foundation. The foundation came from the sale of Montefiore. They call us conversion foundations, and we haven't converted religiously, but we were the conversion of a health entity that delivered healthcare, Montefiore Hospital, into a grant-making foundation. But when we started, they offered me the job for a year, and I kept saying no, because I had this very narrow vision of a foundation. And finally, a wonderful person named Sholem Colme said, "What do you want to do?" And I said, "I want to run a think tank." He said, "Great, you'll have a think tank with an endowment." So, you know, the happiest thing in my life, we have a think tank with an endowment, a wonderful board, and an incredible staff. So how can I be happier?
Well, that's great. And you know, you've played a critical role in so many things. I know it's hard to pack all of this in terms of the work, but the organization started in what year?
Well, 1990, Montefiore was sold. We weren't allowed to use that word, merged with Presby. And 1991 in March, I came on board.
Wow, okay. So the foundation has, for example, at that point in time, played a critical role with your leadership in terms of HIV. I mean, everything that was going on back then. I'm going to pluck a few things, but I mean, I'd like to start there because that's really what was going on in the world at the time.
My interest from college on, I'm fascinated by social movements and social revolutions. How do societies fix themselves? How do societies evolve into places that are more just and kinder to their population? So I got involved when I told you I was reluctant to run a traditional foundation. So I go to a meeting of Council on Foundations, and they have a group called Funders Concerned About AIDS. And I go and I meet the most incredible people. Many of them are still my friends. It was an extraordinary group. Most foundations didn't want to touch it. They had board members who looked at it as, looked on AIDS as some kind of maybe religious or I don't know, whatever reason they didn't want to touch AIDS. So there were a few of us who were sort of revolutionaries, and we came together around the country, and I became very active with them, very active in Pittsburgh. And as I know, there are probably younger members on this call, it was a death sentence, and there was so much we didn't understand. And I remember one of my favorite people, Kerry Stoner, was in the office, and he was dying. I mean, he knew he was dying. He ran the Pittsburgh AIDS Task Force, and he was sweating. And I'm the mother of 3 young kids, caring for 4 parents. And I said, Kerry, I can't take your hand. I mean, we didn't know how AIDS was communicated. And he was so wonderful. He said, let's hug. So we just gave each other a big hug. But there was so much terror. People didn't know how you communicated it. As you remember, children weren't allowed to come to daycare, and even public schools, if there was a parent infected. It was a very difficult time, but we've been committed. We became the fiscal agent for the state. We run the State Planning Collaborative. We run the Minority AIDS Initiative for the state of Pennsylvania. So we have a phenomenal HIV/AIDS team. We've been committed for 30 years. I imagine we'll stay committed.
And I imagine, absolutely. I was just going to say that. And even though the world has changed, what's important to me is that people don't forget that. People don't forget that period of time, particularly people who were younger and didn't experience what you saw and what you were privy to, both positive and negative. So let's talk about the pandemic. We've been connected at the Tech Council because I've been really admiring a lot of the work that you've done, both on the think tanky side in terms of convening people, but also around your advocacy around issues that really early on, we saw a lot of devastation. Obviously, the bifurcation in the community, but nursing homes, we can go back, not even that long ago where you and I and your team were, educating us because we knew that this was such a critical piece of the puzzle in terms of the pandemic. So what kinds of things that you've done over the last year in terms of the pandemic? I really want to shine the light on so many of those things.
Well, we went into a different mode, and the mode was, let's pick a limited number. We picked 3 things where we thought we could make a difference that were influenced by the pandemic. So number 1, let's look at what was happening in nursing homes. We do a lot of training and coaching in nursing homes. We do a lot of work. We've been on a large federal grant for close to 6 years to improve care in nursing homes. And we watched people dying. We knew that it was like lighting a flame near gas or something explosive. And we could not get the traction we wanted. We knew that if you release people from hospitals, what happened, what Andrew Cuomo is being blamed for now, we knew at the time this was a disaster. You can't send someone with HIV, with COVID-19 into a nursing home. You are just lighting a fire. So my daughter said, Mom, are you okay? She said, you seem really over the top on this. And I said, we are. I mean, we know people are going to die. A lot of people are going to die in nursing homes, and they did. So we're turning that into coming up with a new model of care. We want a new model. We want to actually blow up the current model of skilled nursing and turn it into a different approach. We're looking at something we call the teaching research nursing facility connected to academia with excellent infection control but a whole new experience for seniors. So that was one. Secondly, there was no federal agency in charge. So I'm sure everyone noticed. The logistics were awful. Supplies, expertise were never in the right place where they were needed. Some people were hoarding them because they were frightened. They didn't know if they'd be next, but they would be sitting on things that were needed within their region, but they weren't getting from one place to another. And, I sit here in the shadow of Carnegie Mellon, as many of us do. And I said, this is ridiculous. I mean, in no other industry would you have this chaos, this inability to get the personnel and the supplies where they're needed. So we said, we need a national patient safety authority modeled after the National Transportation Safety Board. It's not only the pandemic where we totally screw up in protecting workers and patients, but on an average year, we have at least 250,000 people who die of preventable, I'm going to underline, preventable medical error. And also people who are injured, way more are injured from errors that could be prevented. So again, looking at the National Transportation Safety Board, we realize that all of the technology that we use in transportation for autonomous vehicles, for autopilot, for airbags, do you realize nobody has brought that to healthcare? So that's been a mission to create this agency, particularly one that brings all of the safety technology to healthcare. As you know, Audrey, I've been driving you crazy about this. I listen to your speakers and I say, can we focus them on healthcare? Like, I'm glad you can send the semi down the Pennsylvania Turnpike with me driving and everybody's safe, but I can't get people out of a hospital for a hernia operation without an error. And then the third area we picked is maternity, maternal health, particularly taking another look at what is a successful childbirth. And we just had a program today is Black Maternal Health Day. And we just had a program that was absolutely astonishing. But really our country, if you ever want to see exhibit A of racial inequity in healthcare, take a look at maternity.
Wow.
So those are our three areas, and we've been obsessively focused on trying to bring about reform there.
And you have, like, the thing that we admire about you and that I admire about you is that you have been relentless about the issues that you have seen for so long and feel like the tech community just needs to shift the light slightly, just slightly, and address the issues of patient care, safety, and including, maternal health. So let's dig in a little bit about maternal health. We're looking forward to actually hosting a session on May 10th, I believe, to explore the topic. But can you talk to us about the work, like dig a little bit deeper into that? Because that's an area that has come up through many, many conversations. And unfortunately, Pittsburgh has been highlighted as in the limelight in terms of terrible, terrible results in terms of our care.
In maternal and infant mortality, we absolutely stink. It is so bad that we didn't even have an agenda in this area. We had to. But let me say this, maternity is also a marker for other health issues. We in the United States have amazing blinders. We don't look at other countries. And we think in this country that a successful pregnancy is a live mother and a live baby leave the hospital. So if you go to Australia, which we did, they look at maternity, and the UK does, totally differently. Their idea of a successful pregnancy, it begins preconception, that the mother, the baby, the family unit, that everything is prepared and done as well as it can prior to the birth. And that means 3 risk assessments, where a woman who's assessed at a highest level of risk, a whole host of public services kick in. This is before they've ever delivered, before they ever go into the midwife center or the hospital. And they use their relationship, their ratio of midwives to OBs are an exact opposite of ours. So they have, say, in the UK, I think they have 35,000 midwives and 3,500 OBs. So whatever it is, we're the exact opposite. But in Australia, they follow the mom and the baby home. They want to make sure that they go into the home. They do risk assessment again. They have midwives who come in and do lactation consulting. And if the mother and baby aren't bonding, the country provides child development centers that supports the mom, but also gives extra help to the baby. That it starts right away. You know, you don't have to wait. You don't have to get on a list. And these are fabulous facilities paid for by the state to make sure that the mom and the baby and the family unit are thriving. So it's a whole different approach to maternity, but I think it could work here.
Yeah.
If only we had the support for it.
So, you know, on May 10th, we're actually launching with your organization. We're hosting Ellen Beckjorf of UTMC and Nicole Lambert of Myriad Genetics. So really appreciate that. We're going to do further dives in terms of this space. So really appreciate you pushing us to sort of have a lot of these hard conversations and not sweeping it under the rug. And for those of you who don't know Karen, you should be able to tell she doesn't sweep anything under the rug, particularly when it comes to the issues and the matters that she represents in terms of her work. So, you know, we were pretty excited last year. I guess it was last year. It seems to slip right by me. But last year we did the launch of Liftoff PGH, right? You started that. We tried to help with some of the things in terms of fempreneur. We had some really interesting women from around. Can you talk about the purpose of Liftoff and explain to that? Explain to our listeners that, because there's two things that I just want everyone to understand. Well, they are a foundation. They're also, and Karen made reference to them being a research arm and a think tank. And that is really where I think people need to hear the opportunities in terms of the material that they have that is accessible to all around all the matters that we're talking about here. So I just wanted to give a shout out, because sometimes people think, oh, she's just giving grants, and that's not the case. You're creating practices, you're creating policies, et cetera. So talk about Liftoff.
So, and we do program demonstrations, research, coaching, training. I mean, we do a lot of things other than just give grants. And we get grants. We get a lot of public support for what we do. So I'm a consumer electronics show groupie, which you would think is funny, because I joke, I'm like the only white hair there. You can pick me out of the 180,000 people in a minute. But what is amazing about CES is, number one, the healthcare, the digital health track, which is beyond just digital health. It's looking into the future, and I get very excited about all the potential. And going down on the floor and getting all the demos of all the different gadgets and devices and things that could really make healthcare much better. That gets me very excited. The other thing I notice, we have very little Pittsburgh presence. So here I am with the largest conference in the world. I'm in the health track. They have their own convention center. It's so huge. And if we're lucky, in any year, we get one presenter from Pittsburgh. I run into nobody I know, not a single person I know. And so Liftoff was our idea. Can we bring the CES spirit to Pittsburgh? Can we get people excited about transferring what is available in technology to what actually happens in the practice or in the unit and at the bedside? And so the goal was to get us inspired, because with the amazing schools of health sciences we have here and the technology edge we get from CMU, which is prodigious, can't we put this all together, and can't we be on the cutting edge? I mean, honestly, we should be I listen, when you go down on the floor, as you know, there are all these stages. Universities are presenting and different countries are presenting. Nobody from Pittsburgh is presenting. And my feeling is we should be taking this over. But if we could transfer some of the brightest minds that I hear on business as usual, and they are incredible, doing safety in other industries to healthcare, Pittsburgh would be on top of the map. We'd have the largest dot.
So here's another just sort of behind the scenes about Karen, is she has watched and listened, and her staff have been involved in participating in many of our shows. Behind the scenes, Karen will say, why does that not apply to healthcare? Audrey, why does not that? And it can be anything from trucking technology to, contactless initiatives to autonomy. So if you're listening here, understand that is the view and the approach that Karen has. There should be no reason that if there's a technology solution that touches humans, that shouldn't be, health should be a part of those solutions. And she's relentless. And I got to tell you, she's opened up my eyes to make me think differently about how people think about their technology solutions. So we're going to be exploring digital twins, and you want to talk about something that totally blows my mind, and the opportunities that they present on May 26th, actually. So can you talk about what excites you in this space?
Well, this will be obvious to all of us. Our research enterprise during COVID, yes, for vaccines, terrific. For treatments, we have this slow, clunky, randomized clinical trial approach. We're not very inventive. Other countries, and there's an article in New England Journal, it's worth reading if this interests you. Other countries took different approaches, and they were much more fleet than we were. There's more we can do to be real time, to be active. And if you're a parent of a kid with a severe genetic disability, you don't have forever to wait. And yet the randomized clinical trial is so slow, and they don't even do a lot of trials for a lot of sort of what I would call less prevalent conditions. So I'm listening to CES, it was virtual this year, and I'm listening to the presentation on digital twins. So I get very excited, right? I'm talking about it to anyone who listens, and I'm talking about it to Lonnie Snyder at the Ioneer Foundation. He said, oh, well, you know, Dr. Sahel, who's, you know, this amazing doctor who's at the cutting edge of science and on the globe, oh, he's very interested. He's starting to do work with digital twins. So Dr. Sahel came and did a presentation. It's absolutely incredible. It's not only that, he is engaging patients. Okay, guys, here's a real revolution, right? He's engaging patients in their care decisions. So by using your digital twin, which has all the same characteristics, the life experience, the demographics, all the things about you, you can look at what different treatments, the pluses and minuses of different treatments, and he's doing it to engage patients as well, so that we can be part of our treatment decisions. So you can, I think, see why I'm so excited about this, but it also cuts the time and it personalizes, it individualizes this for you. Because although we love the idea of control groups, I don't have a twin. I mean, you can put whatever control group you like. There's not going to be, I don't have a twin, there's not going to be another me there. Right. But with the digital twin, there's a me there. So I'm pretty excited about that.
I am so excited by it. Honestly, I feel like, to me, that is one of the biggest inflection points that I've seen in a really, really long time. And, you know, we do have the Chief Technology Officer of ANSYS coming and the founder of Unlearn AI on May 26th. And that is only going to talk about digital twins and some of the things that they're working that are healthcare related and some are non-healthcare related. And it's right here in our backyard. So we're just totally blown away by it. So what else is exciting to you right now? Like in terms of this next 12 months ahead, you know, either concerning and it can be concerning as well as exciting.
Well, I try to reach out to interesting people, right? One of my kids once said, what I do is collect interesting people. I hope so. So a couple of the things, one is the work that's going on at the Applied Physics Lab at Johns Hopkins, and the work that DARPA and DOD are funding on the battlefield. So I'm like over the top on something they have called Madeira, which is a mechanical device, interoperability, blah, blah. So Madeira is like a pod that goes onto a battlefield and you can keep a wounded soldier alive for 3 days. Right. It actually does the intervention. It diagnoses and treats and keeps people alive for up to 3 days till they can be evacuated to the right treatment facility. So, you know, I look at some of the clunky work that happens around rapid response teams in our hospitals. Unfortunately, they're random people who come together in an emergency. And I said, can you fit Madeira in an elevator? Like, if I'm going south, I want Madeira. Can Madeira come and keep me alive for 3 days till you find the right surgeon? Right. So anyway, that kind of is very thrilling. And the other is what can be done with the EHR. So we all like to whine about the electronic health record. We hate it. It's clunky. It's not interoperable. Data aren't up to date. So let's flip that and look at what we can do with that clunky thing that all the doctors hate. what you can do for safety and quality is extraordinary. So I look at, there's a genius from the University of Utah named David Klassen, and he has been amazing. He's the most upbeat person that ever lived. And he tells you all the things you could do right now with the data we have. And that gets me jazzed. So those are two things.
So, I hope everyone who's listening here just gets a glimpse of what the passion is, but also the amount of collaboration that she facilitates, her organization facilitates, because that's really, they are conveners. They actually serve as conveners on policy issues. And those issues, as we've heard, are tied to safety, but it really tied to patient care. But it's limitless. It's limitless in terms of the work that she's been leading and convening. And you've been a treasure. I have been very lucky to get to know you in the role that I've been in, and you've shaken my head, and I'm pretty stubborn, and you've shaken my head. And how do people apply for grants? I mean, there are people who are going to want to know that. Are there RFPs that are open now? What's the situation?
So I told Audrey, I always listen in at noon, and she gives away free gifts, and I never win, right?
You never win. I'm sorry.
I just never win. I wanted that plane ticket to Hawaii.
I wanted
anything in the world. So I said to Audrey, okay, if anyone listening wants to write a letter to me and they have a proposal for how something they're working on can relate to patient safety, quality, a new model of senior care, better outcomes of maternity, anything that is related to health, we will give out 3 small grants, up to 3. So send me a letter, tell me what your proposal is. And I just feel that, everybody comes on and they give away something. So,
wow,
but we'll
that's
look
awesome.
at the letter, and we are giving away $60,000 in 2 weeks, a project we did with Innovation Works,
right?
The Healthcare Safety Challenge. So we're giving away prizes to people around the globe who came up with the ways of applying technology to patient safety. And
so for them to find out, should they go to the website? How should they find
you? They can go to our website to see if they're working on anything that might interest us. But I haven't even mentioned teen mental health. So we're passionate about teen mental health,
right.
HIV/AIDS, the 3 areas I mentioned, and you might find something else there. So send me a letter, tell me what you're proposing, and if it fits with our agenda, we would love to help you further your work.
Wow, that's a surprise.
Not except to Hawaii, but trust me, you may like this better.
No, and trust me, you won't regret being affiliated with the kind of resources that are there. So Karen, all good things unfortunately come to an end, but that doesn't mean it's the ending of our relationship and the work and the collaboration. Really appreciate your leadership. It's just an underestimate in terms of the work that you've done. Any way that we can shine the light on you and your team, amazing collaborators, and you're just thinking about just incredibly hard problems that many people are afraid to address or don't know how to address. So reach out to her. She will respond, I promise you that. And she will have, she will have a lot of ideas, whether or not you get grants or not. She definitely will have ideas. So Karen, Dr. Feinstein, I like calling you that whenever I get a chance. So thank you so much for taking the time. I know you have a crazy schedule and are just absolutely busy. Hopefully that this time will transform into something ecstatic where we're all together, as we mentioned earlier. And, we raise our hats to that. At the Tech Council, we are planning on in-person events soon. So we're pretty excited about that as well. And now tomorrow we have really cool guests as well. And Jonathan, I'm really glad to get both of these folks on. Jonathan, are you there?
I am. I tell you what.
Talk about tomorrow.
We are super pumped because tomorrow, I didn't realize Greg Baer was an author, but we have Greg Baer and Ryan Ladusky stopping by. Their new book, When You Wonder, You're Learning. It's all about how Mr. Rogers and his philosophy actually plays into STEM education and how scientists want to work in this day and age. So it's going to be such a fun conversation with these guys. So happy.
So it's a book. It's a book, right? That's being released next week. And so we want to help Pittsburgh, Greg and Ryan, and it's also on Audible. And we really want to shout this to the world because they've been doing a lot of work in learning in young kids. So thank you, Dr. Karen Feinstein and your incredible team. Thank you for your work and leadership. And I will see all of you here tomorrow. Stay safe.
See you guys.